My next guest today is a data analytics expert. Now, before your eyes glaze over and you tune out, you might want to keep in mind how much data analytics has impacted our lives. Not only in healthcare, but in advertising. Most recently, it's entered the political arena in a big way. Understanding big data is important. Plus, it fascinates me personally. Before I started my own business in 1996 and went out on my own in 2000, I worked for a company that was on the forefront of big data, and I loved it. And I'm still fascinated. So my guest today is Henry.denis, and he is the CEO of Healthcare Information Technology Services, or the HITS Consulting Group. Henry, why don't you say hello and tell us a little bit about yourself and where you're from?
Hello, Susan and the company. My name is Henry.denis. I'm originally from Haiti. I came to New York directly after high school many years ago and attended Polytechnic University. At that time, it used to be called Polytechnic Institute of New York. So we've gone a long way. Today, Polytech is part of NYU, and so we've adopted their colors. So I did a double major in electrical engineering and computer science, graduated in 88, and went on to really delve in the world of computer science rather than the electrical engineering part of it. So worked for a few companies and then settled on Wall Street for the most part, and worked there up until just about 2008. And we all know what happened in 2008 with the crash. So my concentration really became data center expert. And the reason is very simple. It's kind of a coincidence, and life throws things at us all the time that we just have to pick up and run with. The internet age came about, and corporate America really started to utilize the internet as a tool for business. So everyone started to have some sort of an internet strategy and or wanted to bring their business to the internet. So that meant a lot of new applications, and I found myself working on building data centers for high performance applications and trading applications.
So that was like a Wall Street gig.
That was my Wall Street gig for a long time.
Boy, that is a really high pressure, high stress, long commute place to be, isn't it?
That, you can say it again. And now that I am on the other side, I can look back and appreciate quality of life again.
I had a little bit of a similar experience. I spent a lot of time working in Manhattan, and then as part of that job, I was traveling all over the country, seeing all different state Medicaid agencies. So, and now I don't do quite so much of that traveling. So I'm in the same boat.
Indeed. And the beauty of it is I don't have to be planning my weekends around data center maintenance any longer. When you're running high performance applications that are supposed to be available and accessible 24/7, 365, when do you do maintenance? When everybody is sleeping, and you just have to make sure that you roll them around the world based on their time zone. So that was fun.
Yeah. So what kind of training did you have to kind of get into that position?
So, 2009, American Recovery and Reinvestment Act basically was passed. That's one of the very first acts of the Obama administration. And part of ARA was HITECH, the Health Information Technology Act. And basically, it required the healthcare industry to move from paper to electronic. So hence, everyone now is practically on electronic health record. So my background as an engineer and my experience has been moving applications into the proper environment from a data center standpoint and having high performance, highly secure and available applications. That was my background. So in 2006, I got a contract to move a legal service application for e-discovery into a new environment. So that was my eye-opener right there. So 2006 to 2009, we spent all of our time moving legal services from an electronic discovery standpoint from paper to electronic. So what is electronic discovery? Practically speaking, if there is a lawsuit, you basically get us up in and they told you to provide all the relevant documents in this particular case. So before electronic discovery, everyone involved would produce all the documents on paper, boxes and boxes and boxes of papers that needed to be reviewed, redacted, and submitted. So in the world of electronic discovery, all of this could be done electronically. So my job with my team was to select data centers and build them and then move the the review application to that platform. And here came ARA, moving the healthcare industry from paper to electronic. So now I have the engineering background and I have a master's in healthcare administration and certainly the experience with that complete change from an industry that is on paper to electronic. So I saw this as the perfect opportunity, hence the creation of HITS Consulting Group.
Really? That's so interesting. So now I can imagine how deep is the penetration of electronic discovery in the legal environment? Is everybody doing that now, or is that
today is almost 100%?
Really, even the smaller firms.
Even the smaller firms,
because you and I are in the same industry. We're both in the healthcare industry, and although it's been 8 years now that the healthcare industry was required to move from paper to electronic, I'm not sure what kind of practices you work with, but I know a lot of the practices that I work with still have so much paper. Do you find that?
It is interesting that you would ask. From my background, when a decision has been made to move from one platform to another, a project is developed, people are put in charge, and it just gets carried out. So I came into healthcare with that exact same mindset. And I have to tell you, boy, oh boy, has it been a journey. And from 2009 to today, that's 8 years. And honestly, I cannot say that the penetration has been anything that I expected, especially in the small to medium-sized practices.
Now, I know I have my own opinion about why that's happened, but what is your feeling about why so many medical practices have not yet made the transformation from paper to electronic? There's been all of these incentives. There are all these different systems for providers to choose from. There's all this extra training that's been put forth. But how come so many of them aren't there yet, in your opinion?
And in my opinion, the answer is really, really simple. Especially in healthcare. Doctors, dentists, podiatrists, all of these healthcare professionals, they went to school to take care of patients. And in their mind, spending all this time and putting all this investment into electronic is taking them away from patient care. So that's what I hear over and over and over again. Now, couple that with really what is happening in the industry. So you have electronic being mandated, therefore you need information technologists. Security is a major concern, and the HIPAA fines, obviously, that you hear about, they make the case for security.
I'm not sure how much the general public hears about the HIPAA fines. I know for those of us who are in the industry, we've got a keen ear out for it. And every time, it seems like every week there are more and more reports of breaches of data and fines being brought by the government against providers who have not buttoned down their security well enough. But I think other people, the general public, I think they might only hear periodically about the big ones or the ones that might be in their particular area.
That is absolutely correct, Susan. However, the liability is still there. So when we meet with clients and prospects, we certainly talk about that. So to go back to your original question, why do I believe the penetration hasn't been as we would have expected? Information technology support is expensive, and really you have to do it in a manner that would make it sensible.
You mean the fact that my son is really good with computer doesn't mean he should be setting up my medical practice systems?
That is actually correct.
I said that because it's been shocking to me to learn how many practices have that's been their approach to IT has been to go not necessarily with a healthcare IT specialist, but to go with someone they know who kind of like works with computers.
And now we are past that point. It worked for a little while when the electronic medical record system was being adopted and implemented. Now we are not at that stage any longer. Even some practices that have gone through this adoption and implementation, today they find themselves unable to report. Now, you and I know about this entire alphabet soup of MACRA and MIPS and MU and PCMH and so forth. We can be drowning ourselves into all of this. At the end of the day, it boils down to one simple thing. You have to utilize the electronic health record in a manner that allows you to capture data that someone or some government agency or some insurance company wants you to report on.
So I just want to take a minute and back up, because I think, again, we're talking about things that you and I know because we see it every day and we're responding to it. But I think particularly people who are not involved in medical practices and are on the patient end of things might not appreciate the level or the onerous level of data capture and reporting and statistics and gory little details that the medical practitioners are required to capture today. So I don't know if you were part of, I think not, seeing when you came into healthcare. But I remember I've been in healthcare since the early 80s. And I remember when managed care came around, and the big thing was, where there's not going to be any more claim forms. There's not going to be having to worry about all of these details. We're going to be paying the medical providers to take care of the patients. So all we're going to be keeping track of is encounters. And then the first encounters had 10 data elements. And then there were a couple more data elements added. And before you know it, we now have where we are today, where the number of data elements and the sheer level of data and specificity that has to be captured, I think that the average person couldn't fathom or appreciate.
Absolutely. So let's have one example for the audience so that they can start to appreciate what it is that medical providers have to deal with. So at the simplest level, there is a program called Meaningful Use of Your Certified EHR Technology. We refer to it as MU. After 2 or 3 reiteration, now we are at the final stage, and you have quote unquote 10 requirements. Now, the ones that are considered the responsibility of the doctor, I don't think that we find them resisting. So we move from paper prescriptions to electronic prescription. We move from paper orders for laboratories or for radiology. We don't find a resistance there, except that sometimes it's not in the hands of the doctor to determine how to submit or whether there is a means of submitting this order electronically. So if you're using Lab ABC and Lab ABC does not provide you the means of submitting an order to them electronically, what do? This is where the practices find themselves in a very difficult position. The willingness is there, but the technology hasn't quite been made available to them. So that's one aspect. The other aspect would have to do with things that the doctors don't consider necessarily their responsibilities, right? So one requirement would be the patients have to have access to their data, to their record online, which is a fantastic idea, right? So patient portal is a great idea. All the research has proven that if used properly, it can certainly improve healthcare access and outcome. Wonderful, great. Now you're dealing with the population that needs to have the ability to accept that. So if you are in the proper socio-economic and educational work group, you're fine. But when you start to move to certain areas of the country, or even right here on Long Island, it becomes a real challenge. And guess who is responsible for it? It's the practice.
I think that might be exactly the kind of thing that patients might not be aware of or appreciative of. So while you and I can easily follow the instructions, and we've got access to high-speed internet, we've got access to all of those different things. It's great for us to have access to our information electronically through the patient portal, but not everybody has the skill set to be able to manage that. They might not have the comprehension to understand it once they get to it, or maybe English isn't their first language and the information isn't provided to them in their native language. Maybe they just don't have access to high-speed internet.
And there is the other aspect, Susan, that we deal with every single day, right? So the requirement is make the data available to your patients on the patient portal. Wonderful. The practice spends the money and has the portal set up, ready and available. Now you have to take the time to teach the patients how to sign up for the portal securely, change their passwords, access that, and so forth. Now, by the time you put this together for an entire practice, it costs them time and money. They have to have the staff to take the time to really educate the patients and make sure that the patients are utilizing the system properly. So this is just one example, and we have many, many more examples. Now, all this data is reportable. And if you're not meeting the thresholds, you are not compliant. And if you're not compliant, you may get penalties.
So patients, if you love your doctors and you want to make sure that they get the right brownie points when they get scored, sign into that portal. Even if maybe you're not so particularly interested in accessing it. I'll tell you what one of my personal beefs is with the portal. So I've got a couple of providers that I work with as a patient that I love the portal. It's great. It gives me the information that I need, and it actually, in the long run, I believe saves the practice time and money, because I'm not calling them, asking them questions. I can download my own information or access my own information. But there are some other practices who put such skimpy information out there, it's kind of useless.
Indeed, if the information is quite useful and the training is done correctly, then the patient portal becomes a real great tool that will free up your front desk, frankly, right? On the number of appointments that are going to be made using the portal will pay for the training and the time invested in getting your patients to use the portal. But an effort has to be made specifically by that particular practice to have a functional portal.
So I'll tell you what I'd like to do right now. I'd like to take a little bit of a musical break, and then I want to come back and talk about the next level of this data. So now we have an idea of what these data analytics are, what current medical practices are expected to be able to do, some examples of how it works in a patient's life so that our patients in the audience can understand it. And then I think we're going to come back and take it to the next level. Right, Henry?
Definitely. Looking forward to that.
Good afternoon. We are listening to Compa here on WUSB Stony Brook. It is 2:40 846, and you're listening to The Business of Healthcare with your host, Habanero, that's me. And we have with us today Henry.DeNis. He's the CEO of the HITS Consulting Group. That's the Healthcare Information Technology Services Consulting Group. And we're talking about big data. And we set the stage by giving a little bit of background. And what I'd like people to think about is think about years ago how real estate or stockbrokers or even your financial planners, all that stuff used to be much more less regulated and less statistics and less rules and regulations, just like healthcare. And now healthcare is joining that whole series of industries with tons of rules, tons of reporting, tons of data that has to be captured. And you as a patient might not appreciate how much has to go on behind the scenes in your medical practice. And some of your medical practitioners might not appreciate that either. So we've got Henry with us here today, and he's going to help us understand a little bit better what some of these medical practices need to be doing, and maybe some ideas of how they can set themselves up and do a better job of following the rules and putting all those pieces in place. So, Henry, why don't you take it away from there?
Thank you, Habanero. So, the saying in our office is that electronic health record systems should be used by practices to improve their revenue, not let the electronic health record systems actually drive them out of business. So we always ask, are you using your EHR to maximize revenue in your practice? It is a simple question, but the answer is not necessarily that simple. So the example that I just gave earlier can make one start thinking and appreciate the level of effort, not only from a training standpoint, from a reporting standpoint as well. Well, guess what? Practices have to deal with 4, 5, 6 or more of these programs that they have multiple data points to collect and report. Now, we talked about the business of changing the workflow to capture the data, but there is the side of reporting the data. So think about that for 1 second, and when you have to multiply it, you see where we end up. So the flip side of it is, are you getting compensated for what it is that you are doing? And believe it or not, a lot of times we find that practices just receive a check and they put it in the bank and they call it a day. So let's look at a few of the programs. There are a bunch of them that are capitated. You started to talk about managed care a few minutes ago, right? Managed care just love that capitation program, and they used to talk about no claims, right? Now, at least when you're submitting a claim, you have some sort of a determination that says denied or approved and paid. Now, in regards to capitation, what we find is that most practices...
I just want to take a quick second here and explain what capitation is, because that's one of the things that's a jargon word for us. We know what it means, but the layperson might not be familiar with that. What does capitation mean in the healthcare arena?
Capitation simply means that you have a fixed monthly payment that you receive from the managed care company, so that you are managing all aspects of that patient's health within your practice.
So instead of getting paid the 3 different times that patient comes into your office, you get paid one fixed amount whether they come to your office that month or not.
That is correct.
Okay. So, I'm sorry to interrupt. Continue.
Thank you for the clarification. Obviously, this is our world. We just think that everybody knows exactly what we're talking about. So thank you for the clarification. So if you take a small to medium-sized practice, 2,000 to 2,500 covered lives, and every single month you receive a capitation payment, what do we see most practices do? They receive the check and they put it in the bank. And if we ask them, was the amount correct? They don't know. And to add insult to injury, When we looked into this, there are times practices have to return money. We refer to this as recoupment. When they are asked to return money, they just pay the money back or make arrangements to have that money taken from future payment. And we ask them, are you sure that the amount of the recoupment is correct? They don't know. And we started to look into this for a sizable group, about 25,000 covered lives. And we found a lot of errors and omissions.
On both sides, or just in the payer's favor?
We were looking from the practice side, so we did not look from the payer's side. So all the errors and omissions that I'm referring to are hurting the practice. They are not in the practice's favor. So we started to look deeper into that practice. And I have to tell you, if a practice is not really taking care of their own bottom line, no one is going to do it for them. And in this world of diminishing reimbursements, increasing complexity and requirements, which are basically turning into expenses for the practices, it is a perfect storm. No wonder we're seeing so many small to medium-sized practices just failing or selling or merging. They are not able to sustain themselves.
Literally going out of business.
Literally going out of business. And if they are in a profitable environment, they need to do something very quickly in order for them to remain profitable. It's just not the right way of doing business. There's got to be a better way. What we tell our clients all the time is really you need to turn to business data analytics. You need to have a specialist set up a system for you so that you are able to not only track, have the workflow consulting, make sure that the data is captured correctly, reported to the proper parties on time in the format that they want, and circle back and make sure that the payment, right, the compensation that goes along with it is correct as well. And if it is not, you need to be able to say, hey, this is what I get paid. I believe that it is not correct, and here is the reasons why.
So let me ask you a quick question. Is this something that applies to all practices, or is this something that applies to practices either in a particular specialty or that deal with a specific payer mix? And by payer mix, we mean where does most of their insurance money or their payments come from?
Data analytics is applicable to every practice, regardless. The experience that I just recounted, we were dealing specifically with practices that are dealing in the Medicaid managed care world, and most of the time capitated.
So, another thing I want to make a quick mention of, I know a lot of times when I meet with practices, they'll say, oh no, we don't deal with Medicaid. And they might not think they deal with Medicaid, but Medicaid isn't just Medicaid anymore.
Indeed.
You could be treating United Healthcare patients or Blue Cross patients or a whole variety, HIP patients.
Fidelis, Health First.
Well, Fidelis is exclusively Medicaid, but a lot of the traditional payers also have Medicaid managed care lines of business. So I almost always find practices who tell me, oh no, we don't take Medicaid. Guess what? Yes, you do.
Indeed. And even in the private sector, certain programs are capitated as well. We call them quality incentive programs. This is, again, another area where data reporting is extremely important. The payers ask for specific information on patients with specific diagnosis. The reality of it is that they need the data to start trending and make some predictions. It's best that you have data that tells you the patient is about to have a certain condition, a heart attack or stroke or something to that effect, that is going to take them, and put them in a hospital and cost the payers hundreds of thousands of dollars. So it is extremely important to have the data. The data that we are capturing and submitting is finding itself in a bigger pool of data that they run analytics on so that they can make predictions.
So now Medicare is moving into this arena where all of these data analytics are going to be really important. And I'm going to bet any amount of money that the layperson, the patients out there, aren't familiar with the MACRA and the MIPS and the the alphabet soup of programs that are coming out soon. So it sounds like it isn't just Medicaid providers; it's really anyone who deals with the big payers.
Indeed, and Medicare is the data analytics for Medicare is huge, and MACRA MIPS is here today, and we talked about meaningful use, and a lot of people may have heard of physician quality reporting systems, PQRS, and so forth. Well, they have all been wrapped into one program called MACRA. So meaningful use is not going away. It's still alive and well within MACRA.
So, Henry, is there any final things you wanted to say as a wrap up here? And I just want to point out, anyone who wants to get in touch with Henry or has questions for him, his contact information is on my playlist at WUSB.FM. Go ahead, Henry.
So, in closing, I always advise practices, especially the ones that are independent and are fiercely against selling out or merging, that they look at data analytics as a means of increasing their efficiency and their bottom line. At the end of the day, healthcare has changed. We are in this new world, and the pendulum will swing back probably to center, but right now it's all the way far to the right or to the left, whichever way you look at it. And data analytics will help providers meet the demands and keep their practices independent. We only work with independent practices, and we are there outsourced to make sure that they remain thriving in this new world.
So Henry is also a member of the networking group that I belong to, and it's called Healthcare Introductions, and it's open to really anyone who works primarily with medical practices. It's not one of these expensive or fancy groups. We just get together and talk about the industry and get to know each other. So as we were talking with our prior guest, Stephen Peltz, the best consultants can't answer every question you have, but they can point you in the right direction or introduce you to somebody that can. So if anyone's interested in finding more about that group, you can get in touch with me. You can send me an email at habanero@wusb.fm, or as well, you can look on my playlist for contact information. So, Henry, I'm sorry that we have to hustle out of here, but we're kind of like at the end of our rope here. I just want to thank you so much for coming in and being on the program today. You're listening to The Business of Healthcare with Habanero.